Imagine this: you're enjoying a meal with friends, laughing, and then suddenly, someone starts coughing. At first, it might seem like a harmless cough, but soon it becomes clear they're choking. It's a terrifying moment, and it can happen to anyone, anywhere. But here's the thing: knowing what to do in these crucial seconds can make the difference between life and death. This video will guide you through the signs of choking, how you can respond, and some simple yet powerful ways to prevent this common but deadly emergency. The swallowing process. To understand why choking happens, let's start by looking at how we swallow. It's a surprisingly complex process. When you chew food and get ready to swallow, your tongue pushes it to the back of your throat. At this point, there's a small piece of cartilage, the epiglottis, that temporarily covers your windpipe. Its job is to stop food from going down the wrong pipe. At the same time, a muscle called the upper esophageal sphincter relaxes, opening up the esophagus so the food can slide down to the stomach. But if anything goes wrong, like the epiglottis not closing all the way, food can slip into the windpipe instead. This can cause either an uncomfortable blockage in the throat or a dangerous obstruction in the airways, leading to choking. Signs of choking. Now, let's look at the signs that someone is choking. Recognizing these signs quickly can help you take immediate action. Some of the key symptoms include silent coughing or gagging, wheezing sounds, clutching the throat, difficulty speaking or breathing, skin turning a bluish tint, known as cyanosis. If a person is unable to speak, cough, or breathe, they might need the Heimlich maneuver. This technique, also known as abdominal thrusts, can help dislodge food or an object from the windpipe. Performing the Heimlich maneuver. The Heimlich maneuver is a simple technique that can be a lifesaver. Here's a quick guide on how to perform it. 1. Stand behind the person and place both arms around their waist. 2. Make a fist with one hand and place it just above the person's navel, but below their rib cage. 3. Grasp your fist with your other hand and give a quick, upward thrust. Do this 6-10 times, quickly and with controlled force. 4. Continue the thrusts until the blockage clears or emergency help arrives. If the person becomes unresponsive, it's essential to begin CPR until help arrives. Remember, the Heimlich maneuver is not suitable for young children under 1 year or for women in the late stages of pregnancy. In those cases, different variations are necessary, and you should always seek medical advice on proper first aid for these groups. Self-administering the Heimlich maneuver. What if you're alone and choking? You can perform the Heimlich maneuver on yourself. Find a chair and lean over the back of it while performing the thrusts, using the chair's back to apply pressure to your abdomen. This technique can be just as effective in dislodging a blockage when there's no one around to help. Non-emergency food blockages. Sometimes, food doesn't enter the windpipe but gets stuck in the esophagus instead. This can be uncomfortable but is usually not life-threatening. If this happens, try some of the following tips. Swallow small sips of water or soft foods to help push the food downward. Drink a carbonated beverage or take an effervescent tablet to create bubbles that may help dislodge the blockage. Take simethicone, a medication that can relieve gas and may help push the food down. Who's at risk? Choking doesn't discriminate by age, but it does tend to occur more frequently in certain groups. Children under 3 years old are at a higher risk because they're still learning to chew and swallow properly. They may also put small objects like toys or coins in their mouths, which can lead to choking. Adults over 60 also face increased choking risks, often due to reduced saliva production, difficulty swallowing, or conditions like Parkinson's disease and dementia. In fact, choking is the 4th leading cause of accidental death. Prevention tips. Preventing choking is as important as knowing how to respond when it happens. Here are some practical ways to reduce the risk. Eat slowly and take smaller bites. Chew food thoroughly before swallowing. Avoid distractions, like walking or driving, while eating. Don't drink too much alcohol with your meal, as it can dull your reflexes. For children, consider these additional steps. Keep small objects like coins and small toys out of reach. Encourage children to sit while eating and to chew their food thoroughly. Avoid giving young children certain foods, like whole grapes, hot dogs, nuts, and hard candies, as these are common choking hazards. Medical conditions that increase choking risk. Some people experience a condition called dysphagia, which refers to difficulty swallowing. Dysphagia can result from various health issues, including neurological disorders like stroke or muscular disorders that interfere with the swallowing process. For these individuals, swallowing safety strategies may be necessary, such as altering food texture, like mashing or cutting food into smaller pieces, changing head or neck position when eating, using behavioral techniques like tucking in the chin while swallowing. If you or someone you know struggles with swallowing frequently, it's essential to see a doctor. They can perform tests, like a flexible endoscopic evaluation or a video fluoroscopic swallow study, to identify the problem and suggest personalized strategies. Conclusion: choking is a scary experience, but it doesn't have to end in tragedy. Knowing the signs, performing the Heimlich maneuver, and understanding how to prevent choking can save lives. Remember, it's not only about eating carefully but also about being prepared to step in and help someone else. By following these tips, you can make mealtime safer for yourself and those around you. And if choking is something you experience often, don't ignore it. Seek medical help to uncover the underlying cause. Choking can be a matter of seconds, but those seconds can mean everything.